Prostate cancer is the most common cancer in men worldwide and is the second leading cause of cancer mortality. The word prostate is derived from the Greek words pro meaning before and stratos meaning standing, referring to the location of the prostate as standing before the bladder at its base surrounding the urethra. The prostate's function is to secrete a milky white fluid that makes up roughly 30% of semen, along with spermatozoa and fluid from seminal vesicles. While there are many diseases that affect the prostate, the most concerning is without a doubt prostate cancer. Treatment of prostate cancer depends on two properties of the tumor, referred to as the stage and grade of the tumor. The stage can be thought of as how far the tumor has spread within different regions of the prostate or to different areas of the body. The grade is determined through a biopsy or a tissue sample, which a pathologist can then view under the microscope. This is reflective of how dangerous the cancer is. Curative treatments for prostate cancer include surgery to remove the cancerous prostate, or traditional radiation therapy, as well as brachytherapy, a different kind of radiation therapy. Traditional radiation therapy, referred to as external beam radiotherapy, or EBRT, involves directing radioactive waves at the patient's prostate from a source outside of the patient's body. Brachytherapy, on the other hand, is a more invasive technique that involves inserting a radioactive source directly into the prostate through the patient's perineum, the area between the male genitalia and anus. Brachytherapy can be performed in one of two ways, referred to as LDR or HDR, low dose ratio and high dose ratio respectively, which are reflective of the dosage of radiation being delivered to the prostate. HDR has the advantage over external beam radiotherapy in that it is able to deliver a high dose of radiation to the prostate at once. When given in combination with external beam radiotherapy, this can reduce the number of treatment sessions that a patient has to go through, which are often upwards of 25 in number. This high number of treatments can be troublesome for patients that have to travel long distances to treatment centers or have other commitments such as work. Additionally, delivering the radiation in a single high dose is thought to be well suited to shrinking the prostate cancer based on the radiobiology of the tumor. Finally, HDR brachytherapy has the advantage of being able to deliver the radiation in a more direct manner so that there is less damage to adjacent tissues, which can cause troublesome side effects. Our research compared two of these types of radiation, external beam radiotherapy given alone and external beam radiotherapy given in combination with HDR brachytherapy. Looking back in time through patients who received each of these radiation treatments, we found that patients treated with a combination of external beam radiotherapy along with HDR brachytherapy had significantly better outcomes than those treated with external beam radiotherapy alone. We hope our research will add to a growing body of evidence that demonstrates the efficacy of HDR brachytherapy that will lead to further optimization of radiation protocols and lead to better treatment outcomes in the future for patients treated for prostate cancer.